yourself as comfortable as you can. You can put down your things and just try to relax. I can see that you might be feeling a little bit nervous or uneasy right now. I want to tell you right away that those feelings are perfectly normal. Most people feel a bit of butterflies in their stomach when they visit a doctor. So you are not alone in that. We are going to take everything nice and slow and easy today. There is no rush at all. How about we start by taking some deep, calming breaths together? This helps our bodies feel a bit more at peace. We will start by breathing in through our nose and then blowing the air out slowly through our mouth. Ready? Let's go. In through your nose and out through your mouth. That is it. Let's do it again. In through your nose and out through your mouth. And one more time, dive into your belly through your nose and letting it all go through your mouth. That was wonderful. You did a great job. Does that make you feel even a tiny bit better? It is amazing how just a moment of breathing can help us feel more grounded. Sometimes we forget how much power a simple breath has. Now I see that you have already checked in with our friendly nurse. She told me that she took your temperature and checked your weight and height. Having those numbers is helpful, but they are just a small part of your story. Today, the rest of it, I am going to ask quite a few questions so I can really understand you. We will talk about your history, your family, how you live your life every day, and we will spend a lot of time talking about your anxiety. After we talk, I will do few simple checks. Nothing crazy, I promise. I will just check your blood pressure and listen to your heart and your lungs to see how hard time. So let's start with the big picture. How have you been feeling lately? We can start with the basic of your anxiety first. When did you first notice that feelings are starting to feel this way? Does your chest feel tight, or does your breathing get heavy then? It is very common to feel that way. So thank you for being honest. Have you felt ever dizzy, like the room is blinking, or lightheaded, like you might lose your balance? If that happens, does it happen often? I wonder if it happens at a specific time, maybe when you have not had enough to eat or when you stand up too fast. Also, have you noticed any puffins or swelling in your ankles or your feet? Sometimes our bodies hold on to water in those spots. It is a good to hear that you have not had any trouble with that. Have you ever fainted or felt like you completely lost track of where you were? And that about your energy. Have you been feeling really tired lately, even when you have not been doing much? Sometimes our bodies just feel worn out. Do you have any heart problem that you already know about? No, that is good to hear. Have you ever had any surgeries or special medical work done on your heart in the past? Since you have not had any big heart issue, I imagine the answer is no. But I always like to double check. Let's talk about your family for a moment. The people you are related to by blood. Does anyone in your high cholesterol or the sugar sickness we call diabetes? It is helpful to know if those things run in your family on your mother's side or in your father's side. Thank you for helping me piece that puzzle together. Now I want to ask about your daily habit. Do you smoke or use any kind of tobacco? I promise there is no judgment here at all. I just need to know so I can take the best care of you. And how often do you have a drink with alcohol in it? Is that something you do a few times a week or just once in a while? Let's talk about any pills or medicine you are taking right now. matters, but I like to keep it in my mind. How many milligrams is that one pill you take? Do you take it once every day or 2 times a day? And is there anything else you're taking, even if it's just a vitamin? It helps me understand how everything in your body is working together. You're doing so good. Can you tell me what you usually eat in a day? And you find yourself eating out at a restaurant or getting fast food often? And how do you like to move your body? Do you go for walks, do cardio, or maybe lift some weights? Moving is so good for our hearts. Also, how many hours of sleep do you get on a normal night? Okay. Sleep is when our hearts get to rest and heal. Okay, let's turn the page and talk about your anxiety. This is very important part of our research. How long has anxiety been a part of your life? Do you remember something specific that started it, or did it just slowly show up over time? How often do you feel those feelings of worry or panic? When those feelings come, what does your body do? Does your heart start racing like it's running a race? Okay. Does your chest feel tight like someone is squeezing it? Do you feel like you are breathing too fast or heavy? Getting enough air? Okay. Sometimes certain places or situations can make the anxiety much worse. Does that happen to you? We talk about your heart racing, but do you ever get scared that you are having a heart attack when the anxiety gets really bad? It is good that you are not worried about that, but we want to make sure your heart stays strong. Does the anxiety make it hard for you to want to exercise or maybe active? Sometimes it is hard to move when physical exam. Even though I am a heart doctor and not a therapist, I care about what is causing you stress. Is it your job, your own life, or maybe your relationship with your spouse? It makes a lot of sense why you would feel anxious if you are dealing with all of that. I am so sorry you are going through those hard times. We are a team now, and we will find a way to make things better. As a mental health expert ever give a name to your anxiety before? Okay. Are you getting any help for it right now? Like talking to someone or taking medicine? How long have you been on your current medicine? Have you tried other ones before? Sometimes people stop taking them because of how the medicine makes them feel. If you had to pick a number from 1 to 10, with 10 being perfect, how well is your anxiety being handled right now? A low number just means we have some work to do, and that is okay. Does the anxiety stop you from doing things you need to do every day? We talk about your heart racing, but do you ever get scared that you are having a heart attack when the anxiety gets really bad? It is good that you are not worried about that, but we want to make sure your heart stays strong. Does the anxiety make it hard for you to want to exercise or maybe active? Sometimes it's hard to move when your mind is busy worrying. Before we move on to the physical exam, I want to ask one more thing. On a scale of 1 to 10, how anxious do you feel right this second? Please be honest. You won't hurt my feeling. I just want to see where you are at. It sounds like you are a bit more nervous before you walked in, but I am glad you are shut, I can listen to it. Just stay relaxed now. Let's listen to your breathing. Take a big breath in. Hold it for a second. And let it out. And one more. Take a big breath in. Hold it. And let it go. One more. Take a big breath in. Hold it. And let it out. Perfect. Your lungs sound very clear. Now let's check your blood pressure. You have probably this done before. Is that peptic seals that goes around your arms and gives it a little squeeze. We will use your right arm. Just let your arms rest and try to be still. It might feel hard to touch for a moment, but it will be okay. Here goes. Great job. That was too bad, was it? Your blood pressure right where it should be. Now I'm going to feel your pulse at your wrist. Just give me your hand. Just feel him for the beat of your heart. You have a very strong and steady pulse, which is wonderful to feel. Next, I'm going to gently feel around your neck to check those little knots and sound waves to take details, pictures, and of your head while it's beating. We have the machine right here in our office. I also want you to get a little bit of blood work done just to check on your levels. Once we have all the result, we will sit down together and go over everything. Do you have any question for me? You did such a fantastic question. Just chorus. You can act back out the way you came in and talk to Lisa at the front desk. She is wonderful and will help you set up your next visit. It was so good